took a couple of things from your Instagram post.
Okay.
And I wanted to start with this one.
Okay.
Let me hold the door for you. I may have never walked in your shoes, but I can see your soles are worn. Your strength is torn under the weight of a story I have never lived before. Let me hold the door for you. After all you've walked through, it's the least I can do. I've been talking a lot with some folks about healing the healer.
Mm-hmm.
And I was doing an artist talk yesterday, and we were talking about purpose. And one of the things in purpose is, I asked the guy, Blake Pierre, I said, how does it feel to live in your purpose and contrast that with not living in your purpose? He said, sometimes it feels like you're a slave, like you have to do this thing. You don't know where it's coming from. You just feel compelled to do it. And sometimes this function that we're performing appears to be efficient, appears to be without challenges.
Mm-hmm.
But when I look at your post, I can see, in addition to the smile, in addition to the radiance and the positivity, like there's this undercurrent of struggle. If I am wrong, please tell me.
Pretty accurate.
Okay. How are you?
I feel like I'm in transition. So some days are good, some days aren't. And I feel like that's part of the transition, is the ebbs and flows, if you will.
Okay. You posted something on May and you said, y'all, I'm really fighting for my life right now. One thing about me, I know how to make things look all good. It's a gift, and honestly, a curse. So much has happened in the past few months. If I told you, you probably wouldn't even believe it. But here's what I do know. The only way out is through. Dancing has been my lifeline lately. It's where I go to move the heaviness, to shift the energy, to get still enough to see clearly again. It's my safe space. People look from the outside and make their own assumptions. That's fine. But I'm beyond grateful for the ones who really know me. My circle's been holding me down, loving me, reminding me of who I am, and helping me make it through. Can you share what was going on?
I think it was, in that point in time, there was multiple things going on, from career shift and sabotage to recognizing some of the gifts that I have are being shown to a greater purpose, or being in a place of that I'm moving in a different space.
Okay.
And so accepting more tasks of being of service to people and leading as being felt energetically that I'm moving to. So it's closing one chapter, opening another chapter, and then enduring some of the insults my former employer, toxic working environment, pushing through that, and then looking to what's next and being tapped for something that is greater.
I'm looking at your titles. Obviously, there's
a few.
A lot of, you've got more letters behind your name than anybody that has ever sat on this podcast sat in that chair.
Wow.
You got a DNP, an RN, a CS. What do you do? What's happening on the back end with all of these letters behind your name that's causing all of this angst?
Great question. So in nursing, we like alphabet soup, if you will, but professional, I'm an acute care nurse practitioner, and I also serve as faculty in academic settings. So I teach graduate level nursing students how to be nurse practitioners. So my DNP is a doctorate in nursing practice. The ACNP is acute care nurse practitioner. And then the rest of the stuff is just distinctions of being an expert in my field. So, but the main thing is nurse practitioner.
So I've got some letters behind my name too.
Okay.
Can I share?
Yes, absolutely.
James Shelby, GED. Just putting that out there.
Listen.
You wouldn't know, by the way, because I try to hide it. But no, how has the journey been through all of that?
Ebbs and flows.
Okay.
I think growing up in single parent, only person to go to college, so lots of pressure there. I feel like it's been pressurized now that I think about it throughout my whole journey, throughout my educational experiences. And then as you ascend to different levels, there's less representation. There's more of a minority / black tax to conform, fall in line, and then also prove yourself that you're worthy of being in these predominantly white spaces.
Mm. And that sounds like the black tax. Mm-hmm. It's emotional, it's physical.
Spiritual, just mentally exhausting.
These kind of relationships that get disturbed when we don't take the time to know what it is to sing, to know how to get close to the mic again. But it's singing doesn't make it happen, or maybe.
So in addition to the alphabet soup of all the DMP and art, the woman you guys are listening to is a doctor of alphabet soup,
Yes.
nurse practitioner.
Yes.
She is also the CEO and founder of DOC,
Yes, DMPs of color.
DMPs of Color. Welcome
Thank
to
you.
Tone the Fork. Can you tell people what DOC is and what compelled you to get started with that program?
Mm-hmm. So DOC stands for DMPs of Color, and it's a nursing organization that focuses on nurses of color specifically that have their doctorate in nursing practice or desire to have their doctorate in nursing practice. And essentially, we've curated this space that is psychologically safe. We focus on programming, events, and opportunities that this group of nurses might not have had in predominantly white spaces. And so the way nursing is set up, when you have this advanced education, it affords you opportunities to different seats at different tables. And it allows you to have a certain level of power, shot calling, boss, chief, dean, director. And it also puts you in a different tax bracket, if you will. So, but what happens is a lot of us have gone through predominantly white spaces like tooth and nail, but no one's sharing the game secrets on how to leverage this power, how to leverage the expertise, how to leverage the shot caller energy, how to move things. And so we're the only professional organization for this group of nurses to be able to curate and understand that and how to show up in these different spaces that ultimately impacts our communities. And so for me, I created this group because of my own experience, being the only Black woman in a predominantly white institution and experiencing that gatekeeping. Like looking around and my cohort mates are getting access to funding and different opportunities from speaking and teaching and, you know, international educational trips and stuff like this. And I'm like, I'm not getting the same thing. And so talking through them and like, oh, my mentor, and I'm like, okay, so I need to figure this out because I want to have the same fullness in my experience as well. And so I tried finding a community within the existing nursing organizations because in my mind, I'm like, why am I going to reinvent the wheel? But I was so specific in what I was looking for. I wanted a group that focused on nurses getting this level of education and that identified as being a person of color. So I threw together a Facebook group not knowing it was going to blow up.
Okay.
Because so many people had similar stories or similar experiences of the gatekeeping or clawing tooth and nail. I'm the first one to get a doctorate. I'm just kind of making it up as I go along. And then being shut out of getting access to resources to get the best experience, to be the best in the particular field. So the Facebook group grew exponentially, and then a couple years later, I formalized it into a nonprofit membership-based organization.
And was that in 2016?
So the concept came to me in 2016, and then we officially became a nonprofit in 2018.
Okay. And so this is post-schooling, correct?
Yes, I graduated in 2017. So it was like last year of schooling, I'm like, I got to figure this out because I have this dissertation to write and I don't know what I'm doing. And then post-school really revved up and launched.
So I'm imagining there were issues going through the educational piece as well in terms of faculty representation, support, and
absolutely. There was only one Black faculty member, and I can tell she was exhausted of one being the only one and having to navigate for herself to maintain her status and ability to be in these spaces, but then also being tapped constantly by students of color, like, you know, hanging on, like, you're the only, you know, representation. And so I got that energy from her that she was just exhausted. So that's where the community was critically important because I was like, I'm not getting it internally. I have to find it externally because quitting ain't an option.
Okay.
And so the external support literally helped push me through to the finish.
And so now are you going back and does DOC support women in the on the educational side as well as post-education, post-degree?
So we're like full from like, you know, people that are interested in going back. So we support them there, people that decide to go back, and then when they get out in their professional lives. So we're full spectrum because that's needed.
Okay.
Because the doctorate level education is at PWIs, predominantly white institutions. There's only, out of all the HBCUs and minority serving institutions, there's only 7 nurse programs that have doctorate level education out of, I think it's like 48 nursing schools at HBCUs. So
Wow.
These folks are going through these white spaces and literally being traumatized just to get an education, because that's just the system that we have to go through.
What are some examples of that marginalization? Is it not being believed or not? I'm trying to.
I mean, it can be something as simple as asking students questions that put them in positions to be representative of the Black community.
Okay.
I remember when Ferguson was going down and it was like, you know, you're part of the Black community. Why are they rioting in Ferguson? And it's like, okay. Or it can be something as vicious as deliberately either being highly scrutiny over their work.
Okay.
Or flat out bullying. Like I've seen faculty flat out bully and intimidate students. Just off the strength of either they just don't align with the majority of the school.
So what kind of support does Doc offer these students as they go through their programs?
So we offer scholarship support. There's also opportunity for mentorship, which is literally the key to success. And what people find to be the most valuable piece is to have someone that's been there, done that, and that can offer them that space. Because the way when nurses of color, students of color show up in these white spaces, some of the things that they're witnessing or experiencing, it's hard to articulate. Mm-hmm. So sometimes when you're amongst a community, that what's understood doesn't need to be explained. And that's all you need. And that's enough to fuel you to keep going. Because it's like, you see me, you understand me. I don't even gotta explain. All I gotta do is be like, these people right here.
Yeah, and that's all you need to,
done.
Like, boom.
You know, just so that they can be refueled to go back to finish, because we know you've been a person of color all your life, you've been Black all your life, you know this is part of it. Whether you choose to accept it and take what you can and pour it back into your community, or you let it eat you up and traumatize you.
And let me make sure that I'm clear. Mm-hmm. I wasn't asking for examples for you to justify, because sometimes I know what that's like, and that's not what I was just trying to imagine, like, some shit is overt, and then some of the shit is a little bit more subtle in some ways, and it's really the subtle things that I feel. It's like the death of 1,000 cuts, where it's just slow.
And that's
sometimes it's easier to deal with a nigga, get out of here. And you be like, at least it's right out there. You know, thank you.
Show me who you are.
Yeah, it's the other stuff, because you really feel like you tripping and you losing your mind.
The nice, nasty.
Ooh, I like that.
Passive aggressive. The shit smile. You know, it's disgusting. And it's just like, y'all have that much time to be so consumed with what I'm doing that you will find ways to sabotage or traumatize me. It's just wild.
It does feel, well, I don't want to assume that. Do you have white supporters?
Oh yeah, we have members that are white that are part of it, but the messaging always is that the lived experiences and the needs and support and the program and the mission is always going to be centered around people of color and those that have been historically racialized and marginalized. And I can remember we had a conference in Philly, and we had a white person stand up and just take up so much space. And I had to be like, either you're going to ask your question or sit down, because you're taking up a lot of space. And so a lot of folks, white folks that are in there, because we're resolute about the mission, and it's like making it abundantly clear, they're open to receive that feedback. And they're not like, oh, I can't believe you said that. It's like, you know what, you're right, I'm gonna sit my ass down.
Yeah.
Great, thank you.
That's kind of dope that they could, well, number one, that you told her to sit the fuck down.
Yeah.
In your way.
Yeah.
And then number two, that you've got other people there that are supporting you, that know when to sit down, that it doesn't require you to do that.
Yeah, and it's mission critical for me to ensure that we keep that safe space, because people are literally, like our conferences, people have described it as a revival or a healing space, because people are navigating these spaces as the first one, as the only one, and that can be so taxing and heavy. And so when they come, they're like, yo, there's a whole rack of us out here.
Yeah.
Like, okay. And I can come in here with my Air Force Ones, or I can come in here with, my J's, or I can come in here suited and booted. But nobody's looking at my skin, my fro. We're just vibing off community, and we recognize that we see each other, and our level of professionalism isn't confined to one box, because we all recognize we come with a certain level of excellence. And
otherwise you wouldn't be there.
Exactly.
And it's not because DEI shit. It's because you really doing the work.
And that's what it is.
Okay. Now, if anybody goes on your social media, they're gonna know you Black.
Correct.
They're going to know you fly.
Yes.
And they're going to know you the CEO and founder
Yes.
of Doc.
Yes.
You weren't the first one going through this program or going through these situations and encountering this resistance and saw the need, but you were the first to actually hunker down, create the framework
Yes.
to do all of this. I'm imagining you coming from some pretty good stock. Mama,
Yeah.
daddy, family, whatever that looks like. Talk to me about what kind of laid the foundation for you to be
A hustler. I'm a
who we see, who everybody sees.
Oh my gosh, that's absolutely Shelly McCamey, my mother.
What's her name?
Shelly.
Shelly.
Yeah.
Miss McCamey, the world thanks you.
Yes, and she absolutely is the role model for me and my inspiration. Because growing up, single parent family household, she created an environment that was safe, and it didn't dawn on me till high school how poor we were. And so she always maintained love, connection, support that I felt like I could thrive. And she always was like, challenging and pushing and encouraging myself and my sister to do the best that we can and really leverage our talents to go further than what she was able to do. So, and just having that grit and the tenacity and just growing up in a single parent family household, like you got to know how to make $1 out of 15 cents. You got to know how to figure out more than one way to skin a cat. So it really helped me develop emotional intelligence, how to think outside the box, and how to view obstacles and challenges as like, you know what, it's hard right now, but guess what, we're gonna make it through. And that's always was like the philosophy, the energy in our family. And so I carry that into the professional spaces.
Okay.
And remind people that, yeah, you come from humble struggle beginnings, but that's where you learn your character building.
Yeah.
Those are transferable skills to the professional arena, if you will. And in my mind, I feel like it gives me a leg up because y'all looking at this shit like it's hard. And I'm like, I already done figured out 3, 4, 5, 6 ways to how to figure this thing out.
Yeah.
You know?
I feel like what hardship does is it's almost like a callus in a way, but you also get a blueprint for problem solving.
Absolutely.
That you can copy and paste in pretty much any scenario because of the level of creativity people who lack resources just innately develop.
Yes.
You know what I mean? But that doesn't, so as you're describing your mom and that grit, there's another piece that I see and feel when I look at your work, and that is service. Is that mom's too?
Yeah. She's in nursing as well. She did home health nursing and she did dialysis nursing.
God bless her.
I got to see her in action because she would take me with her to her home health assignments. So she always lived a life of service, to the community. And she did a lot of work with young males that were out in the streets just cutting up. She ended up, one example of her work, she created a go-go band for them called Positive Groove. She could see that they all had gifts and talents, and she was like, look, I'm gonna get you this drum, you're gonna do this bass, you're gonna get this mic, we're gonna go up in this bass, I'm gonna teach you how to play to keep you up out of these streets.
Wow.
And so they toured in like Woodbridge, Dumfries area, but it kept them out the streets.
Salute to moms. Now, Pop.
Missing in action.
Have you ever met him?
I have.
Okay.
The first time I met him was, and she always told me about him, but he just, like when they were dating, she got pregnant. He was part of a household that was like, don't be bringing nobody pregnant. And he was advocating for abortion, and she was like, yeah, that's just not gonna work. So they ended up parting ways. But I didn't meet him until my senior year of high school. He just randomly shows up at my school. And my guidance counselor, I was at track practice, and my guidance counselor was like, your dad is here. And he's thinking he's like doing like a family reunion. I'm like, my dad is here. And like the dad figure that I've always known was like my stepfather, my sister's dad.
Okay.
And my great uncle, Mike. And so I'm like, my dad, like, what? I was like, so I go to the guidance office and I call my mom. I'm like, somebody's saying my dad is here. And she's like, hold on, I'm gonna be up there.
Yeah, that's what I'm thinking. Cause
she like, hold the fuck up.
Cause that's just
like,
what I was going to say. Did your mama know that Pop is just popping up?
No, so she got there and, you know, was like, okay, so we all sat down and she was just like, fuck you showing up here like unannounced, that type of thing. So that was my first meeting. So I was just like, what's up? You know, I'm like 17 years old. I'm like, hey, you know. And so from that moment on, tried to develop a relationship. But at the time, he was married to a woman that wasn't really feeling the fact that he's got this child, because they had been trying to have children, but never could have any children. And so when I would visit with him, she would treat me so mean. And I was like, fuck that, I ain't got to deal with this. I'm not going back.
Did he know that she was treating you like that?
I never shared, because I was just like, this is weird, because like y'all been married forever and I'm just new on the scene, and what I look like telling your wife is treating me like some bullshit. Like I was trying to navigate where I fit in this space. Because I was like, we're trying to develop a connection. He's like, this is my loving wife, but this bitch is treating me like some bullshit. So I was just like, you know, and then they were going to eventually get a divorce. And then and from that point on, he disappeared. Okay. And then resurfaced years later, but we're still kind of in this space of like, that's you, it's my life, great.
It sounds like you've, was there anything in that you had to resolve, or was it just water off your back kind of thing?
Yeah, there were some things that I had to resolve, because I felt, you know, when I think about my teenage self, angry that he would leave. So there was that fatherlessness piece. And then when he resurfaced, it was when he was able to embrace his sexuality as a gay man. So then I had to contend with him understanding that of himself and where he fit in being a father with me. But then he also had layers of PTSD and alcoholism that he brought with him. And it put him in a space where he was trying to show up as Danielle in a baby buggy and not looking at Danielle as like, I'm a grown ass woman.
Yeah.
Like, so he was trying to reconcile these pieces, and I'm like, I'm a grown ass woman. I don't need any parental things right now. And so we just there was just like this constant rub that we just could never get on the same page. And at that point, it just was, let's just kind of agree that what happened. You still have a lot of things that you're reckoning with that I don't have the capacity to have space for, because in my mind, I'm like, you're the dad, I'm the child. And so I've gotten to a place of peace of being like, he's this man that contributed to my being here, but I've had examples that have helped me have that father figure piece.
Another thing you see on your socials is Uncle Mike.
Yes.
And I was going to ask you about him.
Yes. Yes.
He's going to come up on 1 year.
Coming up on 1 year of his death anniversary.
I like to make room
Yeah.
for these people who have transitioned. I like to say their name.
Yes.
Tell me about him.
Oh gosh. Uncle Mike stepped in at a point in my life where I needed that foundation, because I was at this crossroads in my life of graduating from high school and then going to be leaving to go to college. So leaving my mama's home, because I consider myself a hip baby.
Okay.
So always attached at my mama's hip, because that's all we got. It's me, my mom, my sister. We're a unit. So there was lots of anxiety, uncertainty, but excitement. But then also recognizing the need for additional support for that next level that my mom didn't have experience for, or the resources, or because she was crying like, my baby is going to college, you know. So he really stepped in to help me take ownership of being an independent person. He stepped in with a lot of wise counsel and love that helped guide and essentially protect me through my college years up until when he passed away. So he always looked at him as like my superhero, because it's like, if I can't figure it out, I know Uncle Mike can figure it out. Or if I needed something, he was always available. Or it's like, it's 3 o'clock in the morning and I'm studying you up. Yes, I'm up, dear. What you got for me? What you got for me? So we would just rap and but he was just a very strong force of strength and grounding and protection and security that I didn't really experience consistently growing up. So when I transitioned to that next chapter of like college student, you know, continuing to understand what it means to be a woman and growing and being independent, like he was that protection that I needed for that next phase.
What did he do for a living? Was he a police officer?
Yeah, he was a Capitol police officer for almost 40 years.
Wow. So did he retire from the Capitol Police?
He did, and no one had that amount of service in the history of the police department. So they did this huge celebration ceremony, and they gave him this like badge, and it said like #1. So a lot of people know of him just off the fact that historically he's the only one that has served damn near 40 years in Capitol Police Force.
And is he a McCamey?
Mm-hmm. He's
Okay.
McCamey.
Mike McCamey.
Mm-hmm.
That sounds like a police officer.
Right? Doesn't it? Yeah, and he's dope. And even though he's gone, he shows up in so many different ways. And I just feel so grateful because it's been so hard.
Yeah.
Because he died unexpectedly. And it's just like one of those things like, yo, we just talked and now he's gone. Mm-hmm. But I'm grateful for, like, I was looking at my watch the other day because he was like a watch guy. And I had like this girly thing on my watch, and then the face changed to this, like, he loved like analog and like, not necessarily Rolex, but like
mechanical watches.
Yeah, where it had like all, and so I'm looking at my watch, I'm like, this whole last watch looks like something I would never pick. And I was like, this is like an Uncle Mike type face of a watch. So I appreciate him showing up, and I appreciate me allowing myself to be open to see those things. Because when he died, like my mom called me at work, and I was in the middle of a meeting because she was like calling. I was like, why the fuck my mom calling? She know I'm at work. So I finally answered. She's hysterical, and I'm like, what? She's like, it's Uncle Mike. I was like, what you mean? She was like, he passed. And it was like, you know, like in the movies when they like, it's like a ringing and the time stops and like the world is like spinning and that person is just like stuck in that moment.
Yeah.
And I was on a Zoom call facilitating a meeting, and I just logged off the call. I was like, I got to get the fuck out of here. So I'm like driving from Baltimore to Fredericksburg, and she's just like gone. I was just like, wait, what? And in that moment I held my breath, and something in me, like it was like something inside me, it was like, if you take a deep breath, you're going to lose that connection with your uncle. So from July until October, I was not breathing deep. I was literally like physically like not breathing. And then I'm getting pneumonia randomly. And one of my colleagues was like, that's grief. And I was like, what do you mean? So I started Googling grief pools in your lungs. She was like, that's why you're randomly getting pneumonia. Like, there's no reason why you need pneumonia right now. I was like, oh my God. So I ended up going to a Reiki practitioner because I believe in alternative medicine, energetic arts.
Yeah.
And so I said, I'm just here because there's a lot going on emotionally and grief or whatever. And she starts doing her practice and she could feel the grief. And she's like, yeah, it's heavy. And then as she's moving the energy, she starts coughing. And I'm like, oh my God. I was like, I'm so sorry. But then in that moment, I was able to breathe. And I was just like, yo, thank you.
That's awesome.
Thank you.
And you still feel connected to him.
Absolutely.
That's
Absolutely.
beautiful. Mm-hmm. Well, Uncle Mike, thank you. Thank you.
Yes. Salute.
I wanted to go back to the high school piece.
Yes.
I watched somewhere about was the desire to be a nurse, did that come in college or come in high school?
It was doctor first. It was doctor and nurse. It went back and forth.
Okay.
And when I saw how long it took to become a physician, I was like, yeah, nah.
I'm good.
So then the decision to do nursing was clear.
And so you had a conversation with someone at your school about your future. Talk about that.
Yeah, the guidance counselor. I was straight A student, very square, straight and narrow, you know, nerdy without the glasses. But because no one in my family ever went to college, I was like, I need to understand how to get there. And I was like, who knows better than the guidance counselor,
That's
right?
their job.
You got one job.
Get people to college.
One job. So I make my appointment at the end of the day because I was like, I want to get through my classes and I want to be able to spend time with her, you know, and then, you know, go on to track practice. So we meet and she's like, well, I think this is, your hopes and dreams and aspirations are great, but because you're Black, your mama don't make over $40,000 a year, you barely got over 1,000 on your SAT scores, you'll never be able to make it in anybody's college because the statistics show that you won't be able to get in, and even if you did, you won't be successful. So I'm sitting there trying to take it all in, and it felt like a punch to my gut.
I'm assuming this is a white woman
White
telling you
woman.
this. Okay.
White woman. And I'm just sitting there like, okay, yes, thank you so much, great. And I can feel the tears just welling up. My mom was like, don't be letting them motherfuckers see you cry. So I was like, okay. So I get to the bathroom and just lose it because I'm like, what the fuck am I gonna do now? Mm-hmm. Like, I don't know what else to do. She's saying, stick to my job at McDonald's, maybe go to community college, but I'm not gonna be able to go to college. Like I have spent my whole high school career with that goal in mind. And my mom's been in my ear like, you're going to college. And I'm like, how can I reconcile this? How can I figure this out? I don't know. So I'm like ugly crying, like, but I have to go to track practice. And so I'm trying to get myself together, but I'm light skinned, my nose is red, my eyes is red, I'm trying to splash water.
Rudolph.
So I get to the track and my coach, Coach Stearns, he's a guy that he don't fuck around. He grew up in New York and he's just like, look, I don't want to see no crying, I don't want to see no tears, I don't want no excuses. So I'm the team captain and he's like, all right, McCamey, go lead the drills. And I'm like, fuck, he gonna see me. So he sees me, he's like, McCamey, get over here. And I'm like, what's up, coach? And he's like, are you crying? And then I just lost it again. And he was like, oh shit, this is for real tears. I was like, yeah. So I recount the story and he's like, if I could shake you, I would. He's like, you have no idea how all these things that she named out were to your detriment. You can actually use to your good. Yeah, your mama, y'all poor, but guess what? You can get scholarships. You can get fee waivers on your application fees. You don't got to pay for nothing if you don't want to. And that lit a fire. I applied to like over 20 schools, ended up getting into all 20. And when I got the letters, gave her the acceptance letters.
Did you?
And I said, I think these belong to you.
Bitch.
Bitch.
I added that.
And she was like, oh, I stand corrected.
Did she say that? Mm-hmm. Do you know where she is now by chance?
I don't know. I was trying to look her ass up. My trauma done blanked out her whole name. So I said, damn, but my coach told me 20 years later, because when I got there, I ended up getting a dean job at a major university, and he came to celebrate. And he said,
the coach did?
Yeah, and he said, Danielle, like the next day, I went to her office and I told her if she ever tries to rip any hopes and dreams from any one of my athletes, that he would have her job and she would be removed from her job. I was like, damn. I said, you threatening people, coach? He said, I don't want anyone fucking around with my athletes. And I didn't realize why he was so protective over us until decades later. Because when I look back at the demographic of all my track mates, we all were from single parent family households. So they stood in the gap as parents for us.
Advocates.
I mean, they did clothing drives, food drives, but we just thinking like, this is what you do as a team.
Yeah.
But a lot of us were food insecure, financially insecure. So they made sure we had cleats and sweats and money for whatever we needed. And it was like, damn, y'all were actually like our fathers.
Have you had an opportunity to tell him that?
Oh, yeah.
Oh, okay.
Yeah, we honored him at the Hall of Fame, both coaches. And one of a group of us like stood up and was like, y'all were our fathers, you know? And I think that they knew that. They were in the motions of that, but in that moment, it was like, yes, you know? And everybody's all boohoo and crying. But we still keep up to this day.
That's beautiful.
It is.
That's a great story. Because what's so interesting, you know, they say sticks and stones may break your bones, but words may never hurt. That is so fucking untrue.
Yes.
Because if they can make you feel good, they can hurt you. Like that's just the natural. I mean, that's how it works. And what I think is so amazing is that words were used in one instance to do this, and then the same thing, words were used to actually set you on a trajectory to get every fucking thing that you wanted done.
And I say that, I tell him every day, I was like, you literally changed the course of my life with that one conversation. Because I was lit. I was relentless with it. I was like, oh, hell no. And I carry that energy with me to this day.
Yeah. Because a part of your, like you said, is it mentorship that Doc does also? Or is it more leadership?
It's mentorship, it's professional development. Because a lot of us come from communities where, like I'm saying, we just trying to get it how we live. So having the language and how to maneuver in these spaces, because when you're in these spaces at the CEO table, the language is different.
Yeah.
The how you even sit and posture yourself is different. And so to be effective, you need mentorship in how to use that strategy. I hate code switching because I'm trying to frame it so that it's like you're meeting the needs of the environment that you're in. And you're in a role, and there's expectations of that role. Like, they don't know you, nor should they have the honor to know you. They know this role, and this is how you flex and finesse in this role. And a lot of that is baked in the game secrets. And I carry that energy of my coach because he was putting me down to the game secrets. Mm-hmm. He was like, she was trying to kill you because that's also part of the game. But if you don't know the secrets, you're gonna be dead before you even start.
Yeah.
So that's the energy I take within DMPs of Color, because I'm like, yo, there's no gatekeeping here. Like, rising tides lift all boats.
Literally.
If you winning, I'm winning, the community's winning, and we can continue to pour back and bring more people with us, because that's necessary.
The code switching thing, I struggle with that a lot in the beginning because I think that's what it feels like because you're doing something you've never done before. And you do feel this nonverbal criticism in a lot of ways, or like these. So you feel like so much of you has to be left at the door, and you gotta practice bringing parts in.
Yeah.
Cause you can't go into a boardroom and be like, these niggas is tripping. You can't do that.
You can't do that.
And you're not code switching just
Yeah.
because you can't do that.
Yes.
You have to find ways. And what I feel really good about is like you've integrated the pieces of you in a way that you can take everywhere
Correct.
you go. And I think people need to see
Yeah.
that, number one, but then number two, also, I'll say it, they need to understand that there's a process for that too.
Absolutely.
And it's okay to feel these things, but to understand that the objective is to get to a point to where you can integrate it all fully and do it in a way that's, respectable, loving, collaborative, and also challenging the bullshit when the bullshit needs to be challenged, because I'm one of those kind of people where my resistance used to just look one way, and that was aggression. Who the fuck are you talking to? That doesn't work. I said that a couple of times in work settings.
Yikes.
And I was in my 20s, it didn't go over well. But I didn't know how to articulate anger any other way. Especially coming from the hood, like, can't talk to a motherfucker who I'm beefing with at school to talk him down. I gotta meet him with some type of physical aggression, some verbal aggression. And the game in business is completely different.
Completely different.
And even though you might know that, you still have to practice it. And you got to give yourself grace for when you fucking up, because you, especially if you coming from certain areas, you gon' fuck up.
Yeah. And I guess for me, my goal is to role model authenticity in all spaces, because I'm just now evolving into a place where I feel comfortable being my authentic self in all spaces.
Same.
And I wish I got the memo early on, because I feel like I endured so much of trying to like dim my shine or shrink in these spaces and like be something I'm not, just so that it's acceptable in their sight.
Yeah.
So for me, having the space of giving people the tools and the resources so that they can speak with power and authority and confidence, like, and I'm come up here with my fro and my J's.
Yeah.
Because one thing you can't take from me is the level of excellence and professionalism and knowledge and skills that I bring, regardless if I'm not dressed in, Stacey Adams or whatever.
This. Oh yeah, thank y'all for attending. She just showed her age, so I wasn't gonna ask her. She's 56, y'all.
Yeah, black don't cry.
Stacey Adams?
I mean, I don't know.
Damn, you gonna go with Bostonians?
Right? Not Bostonians.
No, but when you've done the work, like the work gives you the right, because you're not. I feel like the imposter syndrome is when you're somewhere where you didn't earn.
I've stopped ascribing to imposter syndrome. I just feel like that's a tool of white supremacy to make you dumb down your accomplishments and achievements and worthiness and being in certain spaces. I feel like it's used as a tool to continue to perpetuate dependency on being in a certain space and showing up in a certain way.
So, but that's a part of the process though, no?
I feel like...
Did you always feel like you were supposed, so let's say your first job or your first whatever, and you went into that space and you were the only black person. Did you feel like you belonged there?
No.
Okay.
No.
So I didn't either, but I felt like one of the reasons why I didn't belong there is because I had a GED. Now, if I had a motherfucking PhD, oh yeah, this is my shit. Like, Everybody in here, get the fuck out. Because I felt like, I earned it in a different way.
Absolutely,
but the way that I
yeah.
earned it didn't have
the traditional pathway.
Yeah, it didn't have the currency that some of the other what do they call accomplishments or certifications did. So I didn't think hard work was enough because that's not what the measurement was that I saw other people. Where'd you go to school? Nobody asked me, how hard did you work to get here? Everyone was like, oh, where'd you go to school? Where'd you do this and that and the third? And because I have a GED and I say, oh, I didn't go to school, and everybody went to Georgetown, this person went to Yale and this and that and the third. I'm like, shit, I don't belong here. And that's where that feeling of imposter came from. And I don't like to use the term either, but I do,
it needs a name, if you will.
I'm trying to point to the idea that I don't feel like I did the work because there's a standard that was created in the space that I'm not responsible for creating. And that standard is something that I fall outside of.
That's fair.
Whatever word we use to call that, that's what I was feeling at the time. Now, after I know my motherfucking worth, I know what I'm good at, I know what my skill set is, whether I got a degree or not.
Yeah.
So you can't tell me anything outside of what I know about me.
Yeah.
If that makes sense. But it was a process. It's not.
It's definitely a process.
And sometimes for kids, and maybe it's different because for nursing, you have to have a degree, right? Like you got to get certifications and all of that old kind of shit because you can't.
Yeah. Well, you can, but you may not.
To do BBLs out of the basement.
Right?
Yeah,
oh my God.
Some wild shit's going on.
A lot of shit going
on. What is a DMP? What's an RN? What are these different variations? Why do they have all of these different things?
All these degrees and levels.
Yeah, like what?
They want to take your money, that's all. No.
Is that what it is?
To some degree, yeah. Because nursing is a clinical practice profession where you need a set of skills and competencies to be able to care for people at a basic level. But the DMP is a doctorate in nursing practice. It means that I have gone to school for years and years and years to get a doctorate, which allows me to, it's a stamp that says I have achieved the highest level of education in this particular specialty, which is nursing practice.
Okay.
And then there's the PhD, which is a doctorate in philosophy. Those tend to be folks that are focused on like research and science development. The DMP tends to be those that are actually practicing, taking care of patients and stuff like that. The DMP degree, which is what I have, teaches you some pieces of how to do research, some pieces on how to lead and look at systems and organizations and strategize and how to move power and resources to help improve patient or systems outcomes. Nurse practitioner is an advanced degree. I don't want to say a step, but it's a step up from a registered nurse because nurse practitioners are allowed to prescribe and treat patients.
Okay.
So the nurse practitioner is unique because it combines the nursing model, which is care of people, and the medicine model, which is looking at curing of people.
As opposed, so the RN, a doctor is telling the RN what to prescribe. Or, I'm sorry, the doctor is doing the prescribing with an RN. A nurse practitioner can actually prescribe and write meds.
Yeah, so when you think about so physicians, AKA doctors, prescribe, treat, have patients that they see. Nurse practitioners do the same, prescribe, treat, have patients that they see. The registered nurses are like the boots on the ground, the folks that are carrying out the orders and the tasks and the care of the patients daily. The providers, we collaborate with the nurses, but we're not at the bedside daily, hourly.
Okay.
So we collaborate to create like the care plan that the nurses, boots on the ground, carry out.
What is an LPN?
LPN is a licensed practical nurse. So those are folks that have gotten an associate's degree. So RNs tend to have not only the practical knowledge, but the theoretical knowledge on how to care for people. The licensed practical nurse focus on the clinical practice model, but they all function as boots on the ground and taking care of people on a daily.
What are we missing? We meaning all of the non-ends in regards to what you all do and the challenges that you face with just delivering quality care to patients?
I think people are missing the complexity of how to deliver and care for people and community, because the healthcare system has so many flaws in it that the flaws trickle down into our ability to really just take care of people in a high quality way, but also in a safe way. Safe way meaning that there's lots of budget cuts and stuff that might not necessarily have adequate staffing numbers for nurses to be able to care for people, sometimes safely. And then some of the challenges with, the structures of the systems that dictate the type of care patients can or cannot get can be incredibly frustrating, because being a nurse practitioner or physician, you might want to prescribe certain treatment modalities for your patients, and insurance is like, either they pay hundreds and thousands of dollars or they don't get it. Or from the insurance lens, we don't cover that, so the patient can't get that. So that can be incredibly frustrating, and it puts a lot of stress on the system, which manifests in our ability to actually care for people and what they need and be well-resourced and supported to do that.
Now, are you obligated to tell the patient that that is the kind of resistance you're getting from the insurance companies, or do you just augment the care plan to accommodate what the insurance company will pay?
Yeah, we absolutely have to give the patients the full information so that they can make the best decision, whether they want to pay the hundreds and thousands of dollars that's not going to be covered by insurance, or we look for a different alternative.
So if my mother needed a procedure, and a part of that, the way the insurance covers that procedure states that they're only going to do certain things at a certain time and in the certain steps. You have to notify the patient that we have to do it this way because this is how insurance will pay it this way. Okay.
And if you're not getting that level of communication, you have to push back and ask questions.
How would you know?
And that's another thing, you don't know unless you ask, especially if, I always tell people to always ask. If something doesn't feel right, or if you don't have a clear understanding of what's being said to you or recommended to you, ask questions.
Okay.
And if you don't know what questions to ask your nurse. Are they explaining things properly to me? I'm not understanding. Or if you got some friends that are nurses, bring them a part of the conversation.
Okay.
Because healthcare, if you don't ask questions, people won't be able to articulate any answers or give you sometimes the full story, honestly.
How are you guys supported by these healthcare systems? I know the piece you just mentioned talked about you guys supporting the patients. What about the kind of support, especially as it relates to, I'm asking that because there was the National Commission to Address Racism in Nursing thing that was in that, the information that they came out where they surveyed about 5,000 nurses. And they said, like 30% of the nurses experienced racism from the patients.
Oh, yeah.
And like there's a high percentage where people say, oh, I don't want a black nurse.
Absolutely.
And that's crazy as hell to me to think. But what's crazier is when you go back to the job and they're not supporting you in a way that makes you feel respected and appreciated. And this survey pretty much highlighted that this is something that is very pervasive within the nursing.
Yeah, the racism and workplace violence. And so the instances that I've experienced where I'll have a patient, I don't want a black nurse practitioner, great. So we find someone else to be their provider or their nurse or whatever. It hasn't been until recently where, well, this was pre this administration, where there was like zero tolerance for racist behavior. Like they would, you know, depending on how bad it was and how consistent, and if we could rule out the patient wasn't like delirious or something, it wasn't due to a disease process, they would tell the patient that they have to go to a different facility.
No shit.
But I don't know if that's necessarily being upheld now under the current state of America.
So if I went into my job and said, went into the hospital and said, I don't want a woman, I don't want a black woman, I want a white woman, they would say, well, you need to go to another facility because we're...
Pre-administration, probably, but this administration, probably not.
How does that show up? Like, what kind of rights do nurses have to push back on that kind of shit?
They can refuse a patient, especially if they feel like it's unsafe or the patient has been disrespectful. They can refuse, but a lot of times it makes it difficult because of staffing shortages. So they might swap, but it can be difficult.
I read a statistic that said that black women are 9 times more likely to be a nurse than a dude. Why can't we get brothers into the nursing joint?
I think it's just kind of like the stigma associated that nursing is a female-dominated profession. So a lot of male nurses can get past that. But I interact with a lot of male nurses. Like on my board for DNPs of color, I have like 4 male nurses. And I love it. And they love nursing. One of them was actually featured in the... oh gosh, what journal is that? I think the New York Times, and he's the visionary of us having our own custom Air Force Ones.
Does he have
the locks?
Yeah.
Shout out to Dr. Williams, Michael Williams. He was the one who was like, yo, we need to have our own sneaker line. So I was like, okay. So they had him in the New York Times article with his Air Force Ones in his clinic taking care of patients.
That's awesome.
Yeah.
I also saw that the number of black nurses that there are is really region dependent in some areas. So like the highest percentage of black nurses, they said, are like on the West Coast and in the South. And then like when you get over on the East Coast, shit is sparse.
Makes sense, because I mean, it's reflective of the clusters of where we at.
Yeah. I feel like it's a lot of us here, though. I feel well.
I was like,
yeah, it just touche. Give me 1 second. Do you like being in practice or teaching more?
Oh, I still do a hybrid, so I still practice, but not as much. I'm leaning, as I'm evolving in this half of my career in life, that the teaching is fueling my fire because it gives me that opportunity to plant seeds for the next generation. And this generation of nurses ain't about the bullshit that my generation and older are about.
Tell me more about that.
They're about really pushing the boundaries beyond what we feel like is professional. They are in a place of centering people's humanity and their humanity, their mental health. They're not working overtime or picking up extra shifts if they aren't able to do so. They're taking mental health breaks if they feel like that they need that time to regroup. They're growing up in an era where there was a Black vice president. There is, inclusive language for people that identify as LGBTQ, and there is a sense of wanting to ensure that people get what they need so that they can thrive. Because I know in my academic spaces, a lot of students really push, like, yeah, that sounds good, but what's the policy or that, or what can I do when I become a nurse to push the needle forward? So it's really challenging a lot of the status quo. They're not about it, and I love it. It's different because I come from the generation where it's like, you don't call out, you come in, you do your thing. If someone is mean to you, that's just part of it. They're not dealing with none of that shit. And I'm like, they might be onto something.
I agree. So, to a degree. So remember when I was telling you about what Kelly said about me? And I said, this is going to be an example of it.
Lord.
So as you're talking, I'm not saying I believe this, but I am saying that this is a thought that comes to my head because I'm in your generation. I'm like, that just sounds like they soft.
Yes.
And I know that's not true.
Yes.
Because they're not with the shit. So there is a balance.
Correct.
Between creating space for you, testing boundaries, whether or not you just want to do 38 hours a week because that's what you want to do. What element of it is lazy? Don't want to say lazy, soft. And this is my language. I know you're a doctor, you're way more eloquent than me. But there's a better word, I'm sure. But this is a James word,
show.
soft.
You can say what the fuck you want to
soft.
say.
So what part of it is soft and what part of it is legit? These are things that really need to be tested and challenged.
I think it's 50-50.
Okay.
But what I have found when I'm in my educator bag is making that connection to be able to see through the softness versus the legit, and then helping them develop that softness into a way where it's like, you gonna go through some shit as a nurse. People gonna throw piss, shit, spit, vomit, whatever at you. People not gonna like you. Your coworkers might talk shit about you. They might not help you. So yes, we want to make space for that, but also understand the profession that you're going in, where you have to have a certain level of ability to compartmentalize to be able to get through your shift. Mm-hmm. That's just kind of what it is. But I think that for me, I'm unique in my educator hat with that, because not everybody ascribes to meeting students where they are in their humanity and being able to kind of workshop through that to see like what pieces need to be developed and what pieces is like, okay, like that's some bullshit.
Like I said, that's way more eloquent. Because that was beautiful. That was beautiful because that's the same. We're saying the same thing. Yeah. You're just saying it in a much better way. So, and thank you, because you can't throw the baby out with the bathwater. They do have legitimate grievances. Mm-hmm. The way we were told to do shit was fucked up in a lot of ways.
Yeah.
And we didn't, I don't want to say we just didn't even know it was an option. Like when you don't talk back to your parents, now these motherfuckers is asking why and tell me more. Like I don't see, like you're 12. You want more at 12?
Yeah.
But there's legitimacy to that approach. And I think they are testing the boundaries in those ways. The way you articulated how you workshop through to determine what's just some bullshit and what's legitimate to help challenge them. I just get concerned when we just take what people say for face value, especially these young people, and not explore to try to sift through to the point that you were making. Because some of it is legitimate and some stuff it needs to be challenged, and you got the mental acuity to say, hey, to do that. Do you think a lot of professors and teachers have that ability, or do they just, the kid wants this, so that's what the kid gets?
I feel like yes and no. I feel like it can be institution dependent. I feel like, but also no one teaches you how to be an educator. That's something that you have to learn and cultivate essentially on your own. Because when I transitioned from full-time nurse practitioner world to educator world, it was like, all right, boom, here are your classes. And it was like, okay, so you have to kind of dig through and learn. And so whether you had a good mentor to teach you the right ways, or you learned up some fucked up ways because you saw how you were treated in your educational experiences, or you're seeing how someone else is doing it, it may not be the best way to apply for that student situation. And then also thinking about students, a lot of these came through the pandemic. So post-pandemic, we're seeing a lot of mental health manifestations from that. ADD, anxiety, depression, the inability to kind of handle certain stress and balance that. I've seen a lot of people on the spectrum. And so
in nursing?
Oh yeah, yeah, absolutely.
Okay.
Yeah, and so I think that the educator mindset hasn't evolved to kind of make full accommodations for these learners that come with those things.
Are we seeing an influx of nursing students, or is it staying flat, or is it decreasing?
It's decreasing. A lot of people are not interested post-pandemic in being part of nursing anymore.
So you saw the numbers decline post-pandemic?
Mm-hmm. And they continue to decline because...
Excuse me, real quick. Were these people who were nursing and then decided to get out?
It's all across the board.
Okay.
It's deciding to get out. It's people that are new to nursing. The enrollment numbers are down for people going into nursing school, like across the board. And so it's perpetuating the continued, lack of enough workforce to take care of people, which is scary.
Yeah.
But there's always been a nursing shortage, but it's continuing to increase and get worse.
Are the number of Black nurses going up?
Surprisingly, that's plateaued.
Okay.
The number of white nurses has gone down, though.
My grandmother was an EKG tech.
Okay.
And I remember, all of the, not all, that was a very noble, sought after job, being in the nursing field. My brother's mother was a LPN.
Okay.
And it was just like people wanted to go get these nursing certificates and degrees, and that was pretty prevalent back in the 50s and 40s and shit like that. They raised kids, they pay bills on that shit. Shout out to Granny.
Granny.
What has it been difficult finding partnership as being someone as accredited as you are?
Yeah. Absolutely.
Niggas is soft.
Niggas is soft. Niggas ain't got...
There you go. We brought her back. We brought Danny out. We brought Danny out.
They ain't coming with shit to the table, or they are intimidated because they see the rah-rah energy externally. But it's like, no, baby, I want to be a delicate little flower outside of the rah-rah roles, And for me, because I am a nurse leader that's doing significant, transformative national and international work in the profession. There is a lot required of me to be present and to be leading literal nations. And so me being present at home sometimes is not going to be consistent. And so me being the one that comes home and washes the clothes and makes dinner is not going to be a consistent thing for me, because I'm literally coming home from leading nations and I'm exhausted. So a lot of dudes don't have that partnership mentality.
Okay.
And some folks want, like, you know, the type of caliber woman that I am, but still have, to some degree, the mind frame of traditional roles and how we show up in relationship versus partnership, in my mind, and what I've experienced.
And I gotta say this, because ain't nobody beating me up when we get off the video. I know you
Yes.
through your dude,
Yes.
because your dude is my guy. So I want to make sure when we were talking about niggas is soft,
Right.
so we wasn't talking about your dude.
We say in general.
We saying in general. I want to make sure, because that could definitely be missed. I'm
Yes.
learning how to get better with my words.
Yay.
And try to clear things up sometimes. I struggle, I fail often with that. But you said you wanted to be, you said you got the rah-rah shit in person, out, but you want to be, how do you think you make that transition?
Easy. When I walk out them doors of the office, it's like, all right, like, I'm ready to be soft life. Experience that feminine energy, because when you're for me, when I'm in my leadership bag, there is that pulling of that masculine energy, because I'm in a lot of spaces where there's a rack of dudes, or having that energy to be like, look, I might be cute and things, but I'm not the one or the two, you know? So having that constant push of that masculine energy is exhausting, because I don't know, in my mind, I don't feel like that's the natural state of a woman should be. And so for me, because I've been leading all my life, I'm like, I just want to go home and just relax.
But that's why I asked how you think you show up, because, and
Yeah.
I'm only asking because
Yeah, not because now I'm thinking, I'm like, do I still come home rah, rah, rah?
I guarantee you do. Subconsciously, because it's now.
You're probably right.
The transition to the softness might be a bit longer than like you think.
Yeah.
So we probably have to ask
You're right.
your guy.
Yeah.
Because sometimes how we think we're showing up sometimes isn't exactly how we are. And I think that it's a challenge. Because even with my wife as an example, she's in a leadership role at work. But when she comes home, it's almost of a dump in a way. And I don't be wanting to hear that shit sometimes, most
I don't
times.
want to hear about bullshit back in the night.
Like, because we as men typically don't, we want to connect, but like in a different way. And it's not necessarily even just physical. It might be
Right.
just relaxing and shutting down and decompressing in that way. And there's this balance of managing the energies between the two, especially when your woman is like that type A leader role, because those energies are, you know, they compete versus complement in a lot of ways. And sometimes the guy has to, I don't want to say take on a feminine energy, but at least take his and accommodate so that there isn't conflict.
I would agree with that.
Would agree.
It takes a special dude to be able to see that and do that, because past experiences, it's always looked at like lopsided. And it's like, well, this is kind of how it is. I mean, I don't know how else to unpack this.
Do you think you would miss that if you had to give it up?
Miss what?
That tapping into that masculine energy to lead.
I've been trying to find ways to align it better, because when I look at the evolution of my career, it's taking every opportunity till I found an opportunity that was aligned with where I'm supposed to be. So now I feel like I'm being strategic with the leadership pieces that I take on that are external to what part of my purpose is or where my passion is. So I feel like I'm subconsciously and consciously like scaling down some of the leadership or masculine producing opportunities or extensions of my being, because I want to be in a state of peace, ease, and joy where me showing up is part of me doing what I gotta do, and I don't have to put on a role or a stance or channel energy.
You mentioned being authentic. Is the masculine portion of that authentic?
I feel like yes and no. I say yes because being in leadership spaces, depending on the environment, might require that level of energy because that's just kind of the energy of that space. No, because you have a choice. Do you want to be rocking in these spaces or not?
Is it possible to lead in a different way?
I feel like there can be more of a balancing where there's a balance of the masculine and feminine energy in your leadership space. I'm saying the spaces that I've been, I've had to have pushed more into the masculine just because of the environments that I've been in. So like healthcare systems leadership, CEOs, COOs of hospitals, dudes. I'm the lone one, black woman, rocking with them at the table. I can't be in there like, hey, how you doing? Come here, like, bro flip.
So that's feminine to you?
No, I'm being extra.
I feel you. I'm fucking with you. I feel you.
But there's a certain stance so that motherfuckers know without even saying it.
But so, can we sit here just for a minute?
Yeah.
Okay.
Yeah.
I don't know many feminine women.
What do you mean?
I know a lot of pretty women. I know a lot of sexy women. I know a lot of strong women. I know a lot of driven women. I know a lot of accomplished women. But I don't know a lot of women whose energy, like default, is feminine.
Well, how do you define feminine?
That's where we're going.
Okay.
Because we've been talking about some shit that I don't think because when you just said that, it was like, hold on, maybe we're talking about different things. Even though it was an exaggeration.
Yeah.
Right, I want to be clear. I didn't think that that's what you thought it was. Let me ask you, what is your definition of feminine?
Now you got me thinking about what my definition of feminine is, because when you name like strong, driven, those pieces, that's been my only example. And I guess maybe I'm thinking like, I just want to give it up and just like, have my boo just do everything. So I guess I don't know what my definition of feminine is, because, and I guess when I think about masculine, I think about me having to step out of the things that I define myself in my leadership. Like sometimes I feel like I have to be in a more, I don't want to say aggressive, but I don't know other word to say, like an aggressive, firm way in certain instances that I have when I'm in certain leadership spaces. And that's not my default. My default is not to be like aggressive and pushy and that kind of energy.
I was talking to a good buddy of mine, Daniel Gray. Shout out to you, brother. And he was talking about he's a professor at a school in St. Louis, and he was talking to his class about what feminine and masculine energy is, and it's not necessarily assigned to a gender per se.
I could see that.
But the feminine energy resides more in the being aspect, and masculine resides more in the doing.
I could see that.
And what women's power is in the being. And he didn't go into a lot of detail about what that meant, but something about it rang true to me.
Yeah.
And it's like a woman doesn't have to do anything.
That's true.
Because she's the shit, as is.
Yes.
In her fucking default native state, her essence is enough. Niggas gotta do shit.
Yeah, y'all gotta do shit.
We gotta do shit. We gotta do shit. Whatever that means to whoever gotta do it.
Yeah.
It's almost like even in the ways that we respond, especially men raised by single women, we respond in a way, because typically that man is being raised by a woman who's doing something. Like she doesn't have the opportunity to be because shit gotta get done.
Yes.
To take care of the crib, right?
Correct.
And so because she's not in her state of being, her natural state, there's a certain level of frustration that just comes from that, because you gotta turn into this other thing to keep shit going. And we're responding as children, and we don't know any of this shit. We're just picking up on behavior patterns and all of that. And the mom on top of that doesn't have time to articulate, because she probably more than likely don't know either. She just knows she got another fucking shift to make these ends meet, and that's what that is. So I don't, and this is the challenge with having these kind of discussions, is because every time you try to present an idea to maybe better understand some of these things at play, it gets shot down often because it might not fit a mold, or someone might be saying that you're imposing on woman, or you're mansplaining, or you're doing whatever the fuck it is you're doing, when really you're just trying to understand like this world that we were given. We didn't ask for this shit. We're just responding to the best of our ability.
Right.
And if we can extend grace and create room to have nuanced conversations to challenge these things, I think the better men and women end up being. And I appreciate you for at least even just being honest and saying that you don't know, number one, because to me that's huge. I mean, I could see a woman sit over there and then tell me up and down that I done lost my goddamn mind, or she knows what femininity is, and so it's a powerful thing to say. I'm working through like the idea of this. I mean, I think there's greater opportunity to grow and to find it when you come to the table saying you don't know. You know what I mean? Because I have the belief that so much of my fucking programming is jacked up.
Oh yeah.
That I'm willing to throw a significant amount of that shit out And I'm testing and turning knobs and some of it feels very uncomfortable because it's challenging the archetype of man,
Yes.
archetype of strength, archetype of leader. I didn't understand that leading had very little to do with physical. It's my job to set a fucking tone.
Yes.
I am a thermostat and a thermometer. I'm supposed to set the temperature of this motherfucker house
Yeah.
and then tell my wife what it is.
Yeah.
With love.
I'm glad you sprinkled that on there.
With love. And then ask her, is it too cold? Is it too hot? And she might say, that's a little nippy. Because she ain't got to do shit. You just tell me if you're hot or cold and I'll go change the fucking... You dig what I'm saying?
Yeah.
All this is shit that I'm picking up on the fly. That is a part of my overall idea about challenging some of these notions of things. I do feel a way sometimes. I don't like my wife working.
Yeah.
And I know at her core, she doesn't like to either. And as a provider to whatever the fuck that means, I do feel a certain way that I haven't provided her. I don't think I've ever told her this, that I haven't provided her the environment to just be. And I know in her core she does. She wants to just be. She wants to do her art. She don't want to fucking argue with people about why this homeless person didn't get this or this didn't happen, and arguing with this and that and the third. She just wants to smile and fucking paint her paintings and do her thing.
Yeah.
And that's when she's her happiest. Because I'm being a bitch. I ain't set the shit up right yet, but we gonna get there.
Yes.
But I'm at least acknowledging that. Like it's a truth about our relationship and about how I'm showing up and about how she knows I'm showing up. She's a very smart woman. She can see my gaps better than me in most cases. And I'm being unfair to myself more than anything by even lying, by even attempting to lie when I know she can see. I know she can see. So I hope your relationship.
I was going to say there, you're bringing out some very deep concepts because, you know, just in this moment that state of being is really resonating with me because I think about, because we were talking about like father figures and like my uncle, and I think that's why he was like particularly special for me because he allowed me to just be. But when I think about romantic relationships, nor did I have the example of in women to be able to just be, because single parent family, gotta do. And that's always been the example. And I guess that's what I was just trying to articulate is, yeah, there's never been a real state of just being. My empress on the throne, and all I gotta do is go pee. That's deep though.
Yeah.
And but I also think that society doesn't allow for us to have the opportunity to be and experiment or experience what does that feel like.
Yeah.
Because, you know, when I think about my day job that pays my bills, when I think about when I'm in my energy with my nonprofit, sometimes I feel like I'm schizophrenic because like I'm a completely different person when I'm in the job that pays the bills versus the job that I love with my nonprofit, because I feel like I'm able to just be. Like
in the nonprofit?
Like there's no form or fashion. I am unapologetically, I literally at conference I just show up on stage and everyone's standing ovation clapping. And I'm not even saying anything but just talking like how we're talking. Like I've ditched giving remarks and writing remarks because I'm like, they're not here for the scripted remarks. They're here because I'm being me. Yeah. And that's deep. And I think about it in a relationship standpoint. There's ebbs and flows of being able to be, but there's nothing consistent of being able to be just be.
And there is a way that when y'all are in y'all feminine bag, it's almost like you have the will to WHEEL, to the do. We rely on y'all so much in ways that I don't think we are honest about.
Yeah.
And we need y'all to be, because it helps us do better.
That's true.
And we do ourselves disservice when we don't do what we can to put y'all in positions to be. And I know people want degrees and shit, and we talking about PhDs and doctorates. I think you can still be. It's just a matter of, you were talking about not having the language and like, or not even some, now I think it's about like not having the awareness that that is something even possible.
Correct.
To even create like a new way.
Yeah.
To be in this space and to show up. Because like all we saw was, there are markers and cues that we're looking for and that we're also mimicking. That's not about our authenticity. It's more about survival. Interesting. You okay?
Yeah, I'm pondering too. Because that survival piece resonates with me because, again, my formative years, I didn't know that that was the word, but that's what we were doing, was trying to survive.
Yeah.
And so that survival way of life was normalized for me because I didn't know any different. And yeah.
My mom had surgery last week. And I was in Kansas City for about a week, and we were in the surgery waiting area before you go in. And my mom and I haven't had the best relationship. So crazy. And I said, Mom, I said, I think when you go to heaven, if you believe in it, do you think God is going to say, well done? She started going into all of this shit.
Oh, God.
And I was like, Mom, you could just say yes.
Yes or no.
She started picking apart the journey.
Oh, wow.
Of her life. How she tried to do this good and how she tried. And like everything was about a try. Everything was about everything was about trying. And I was like, Mom, well done.
Yes.
Well fucking done.
Yes.
Let's just leave it there.
Yes.